Health authorities are closely monitoring the bird flu situation following recent cases reported in neighboring countries. While Thailand has not recorded any human cases of bird flu since 2006, officials remain vigilant due to the rising global threat posed by the disease. The Department of Disease Control, or DDC, has confirmed that it is tracking potential bird flu cases, particularly after infections were reported in Vietnam, Cambodia, Laos, and even the United States. DDC Director General Dr. Panumat Yanwechakul explained that these cases are linked to exposure to infected birds and livestock amid rising outbreaks among animals in affected regions. Thailand's geographic proximity to affected countries, high international travel volumes, and extensive poultry farming increases vulnerability to bird flu outbreaks. In response, the DDC is working closely with the Department of Livestock Development and the Department of National Parks, Wildlife, and Plant Conservation to maintain vigilance and preparedness. Dr. Direk Kampan, Deputy Director General of the DDC, stated that all provincial health offices have been instructed to strengthen disease surveillance. Hospital screening points are conducting detailed interviews to identify potential cases. People who have had contact with birds or livestock are advised to report any symptoms, such as fever, coughing, body aches, or difficulty breathing, to health officials immediately. Health, medical, and livestock personnel who face a higher risk of exposure are required to adhere to strict disease control protocols. They are also encouraged to receive annual influenza vaccinations to reduce the risk of severe outcomes and co-infection. Co-infection with influenza and bird flu could potentially lead to dangerous viral mutations. On December 18th, the U.S. Centers for Disease Control, or CDC, reported an H5N1 bird flu case in Louisiana. The patient, a 65-year-old man, had been exposed to sick and dead birds in his backyard. Preliminary investigations revealed that the strain involved in this case resembles those circulating in wild birds in the U.S., Canada, and Washington state.